Welcome to final BDS May DC. Planning cycle is a very important 5-marker question in the subject of public health dentistry. So let's begin. This is a figure given in SOBEN Peter and you should draw in your exams. It describes the steps in the planning process. The first step is to identify the problem, then conduct a needs assessment, collect the data, analyze the data. Next step is to determine the priorities, develop program goals, objectives, and activities. It can be done by identifying available resources, identifying constraints, and identifying alternative strategies. We should choose those activities that are most effective. Develop an implementation strategy. Next steps are implement, monitor, and last is to evaluate. First step is to identify the problem. It can be done by conducting a needs assessment. The reasons for conducting are to identify the extent and severity of a problem, to ascertain the cause of the problem, and to evaluate the effectiveness of a program by obtaining baseline information. The information required include description of the population like the number of individuals, their geographic distribution, population density and degree of urbanization, the rate of growth, ethnic background, educational status, socioeconomic status, diet and nutritional levels, general health profile and distribution of dental disease. The resources available like public and private school system, public transportation in the area, healthcare facilities available, and dental programs in the community, and water fluoride level in the area along with government policies in the area. Conducting a needs assessment can be a very costly endeavor with respect to funds, labor, and time. Alternatives include coordinating with other health agencies or investigating past surveys. Analysis of the data. Once the data is obtained from the needs assessment, the information must be analyzed before the priorities are determined, like cultural and language issues, the age distribution to identify the target groups, educational status to understand community values and plan educational programs, median income and employment types to gauge ability to afford health services, accessibility of health services considering public transportation and location of facilities, types and costs of healthcare services available, fluoride content in water to decide on supplement programs, and political status to understand the influence of government policies. The step is to determine the priorities. Establishing priorities becomes necessary due to limited resources. Health advisory committee should include consumers, community leaders, and providers to assist in policy and priority development. When setting priorities for a community, the planner must ask how serious is the problem and what percent of the population is affected by it. Example, if more number of children are affected by dental caries, then the priority will be to address the problem of dental caries. Then the planner must look into those specific groups that are more susceptible to dental caries, such as preschool and school-age children and low-income groups, etc. Third step is the development of program goals, objectives, and activities. Program goals are broad statements of overall purpose. Objectives are specific measurable endpoints. Objectives should specify the following: what, the nature of the situation or condition to be attained; extent, the scope and magnitude of the situation or condition to be attained; who, the particular target group or portion of the environment in which attainment is desired; where, the geographic area of the program; when, the time at or by which the desired situation or condition is intended to exist. Example, by the year 2025, more than 90% of the population aged 6 to 12 years in community X will be covered under the school fluoride mouth rinse program. Types of objectives are outcome objective, which is the quantitative measure of outcome, and process objective, which is the specific process to reduce or prevent a problem. Program activities describes how objectives will be achieved, including what is going to be done, who will be doing it, and when will it be done. Fourth step is resource identification. The term resources implies the manpower, money, materials, skills, knowledge, techniques, and time. The criteria used to determine what resources should be used are appropriateness, adequacy, effectiveness, and efficiency. Fifth step is identifying constraints. Constraints may result from organizational policies, resource limitations, or characteristics of the community. Example, lack of funding, labor shortages, restrictive government policies, and negative attitudes. One of the best ways to identify constraints is to bring together a group of concerned citizens who might in some capacity be involved in or affected by the project. A group that is familiar with local politics and community structures can not only identify the constraints but also offer alternative strategies and solutions for meeting the goals. Next step is identifying alternative strategies. Planner must be aware of those alternatives that sound good on the surface but may have limitations when closely examined. He should choose the activity that is most effective. Example, in a rural setup where adequate transport facilities are not available, commuting to the dental clinic might be a constraint. Therefore, a mobile dental clinic in place of a fixed dental clinic might be an alternative strategy. Seventh step is developing implementation strategy. An implementation strategy for each activity is complete when the following questions are answered, like why, what, who, when, how, and the cost. Planner must know what specific activity she or he wants to do. The most effective method is to work backwards to identify the events that must occur prior to initiating the activity. Eighth step is implementation. The process of putting the plan into operation is referred to as implementation. Most health programs can be divided into 4 phases of implementation, which should occur in sequence: the pilot phase, controlled phase, actualization phase, and operational phase. Step is monitoring. There is considerable confusion about the use of the term surveillance and monitoring. Surveillance means ongoing watch over group status or community status. Monitoring means day-to-day follow-up of activities. The data typically collected for monitoring include the input data, example financial reports, personnel available and vacancies existing, transportation records, etc. Process data, example specific activities carried out, and output data, example services or goods provided. Last step is evaluation. Evaluation is the systematic assessment of program performance. Definition of evaluation is that evaluation measures the degree to which objectives and targets are fulfilled and the quality of the results obtained. It measures the productivity of available resources in achieving clearly defined objectives. It measures how much output or cost effectiveness is achieved. It makes possible the reallocation of priorities and of resources on the basis of changing health needs. It was given by WHO in 1967. Measurement of the results may be direct or indirect. Direct measures assess changes in health, while indirect measures assess knowledge, attitudes, and other factors when direct measures are impractical. Thank you for watching. If you appreciate this video, do hit the like button and please subscribe to my YouTube channel. Stay tuned for regular updates.